Welcome. This video will give you information about receiving genetic services by telehealth in your home. Telehealth is the delivery of medical care through video conferencing with the healthcare provider in a different location from the patient. You may be familiar with video conferencing with your family or friends through apps like FaceTime or Skype. The video conferencing applications used for telehealth are secure, and the same privacy laws apply to telehealth as to in-person medical services. Sometimes, less secure apps are allowed to be used for telehealth during emergency crises, such as with COVID-19. Sometimes, people receive telehealth services by going into an office or clinic near them and connect to a healthcare provider further away. In this case, there is usually someone at that office who will help orient you and explain how the visit will happen. In this video, we will focus on how telehealth works when you are in your own home. Telehealth helps families to connect with genetic healthcare providers like genetic counselors and geneticists for many reasons. Some reasons to use telehealth are: you live far away from genetics providers, you have difficulty traveling to see genetics providers, you are responsible for child or elder care and can't get to see a provider, you need to practice social distancing during the COVID-19 crisis. Types of services provided through telehealth. Telehealth can be used for many different types of healthcare: primary care, urgent care, prenatal care, counseling, diabetes management, home healthcare, and many other services. Telehealth can also be used by medical specialties like genetics. We call this telegenetics. A telegenetics visit involves connecting with a genetic counselor, geneticist, or other genetics provider who is located somewhere else. The type of medical services you might be able to receive depends on factors such as: are you having a telegenetics session from home or a nearby clinic? Are the genetics providers you need to see available using telegenetics? Does your medical insurance cover visits by telegenetics? Ways to receive telegenetics. Receiving care through telegenetics can be done in two ways. One, similar to an in-person appointment, where it's scheduled with the genetics provider for a specific date and time. Or two, as an on-demand service, where you will be connected to a provider who is available at the time you connect to an online telehealth system. Most genetics providers see patients using scheduled appointments. They will give you specific instructions in advance about how to connect to their telehealth system. For an on-demand visit, you usually get connected to a healthcare provider through a website, which might be through your medical insurance plan, hospital, state health agency, or a private company. Is telegenetics covered by health insurance? Insurance coverage for telegenetics varies from state to state, but coverage is expanding across the country. For some situations, like COVID-19, health insurers are covering telegenetic services to help patients avoid going to clinics and healthcare provider offices. You can always call your insurance provider to check about coverage. Most of the time, there are not extra charges to use telegenetics rather than an in-person visit. If there is an additional charge for telegenetics, think about whether you would have any extra expenses if you went to the visit in person. This might include travel expenses, lost wages, or childcare costs. What to do to prepare for a telegenetics visit? To help your genetics provider, you should try to have information available about your family medical history, your health history, including hospitalizations, surgeries, test results, and medications. In some cases, you may need to submit this information online or by mail before the appointment, or request that your records be sent to the genetics provider's office. What happens during each telegenetics session will depend on the purpose of your visit. The genetic counselor or geneticist you speak with should explain what will happen and answer any questions you have. For on-demand visits, you may be asked to answer questions about your health online before you start your telegenetics session. Just as with an in-person appointment, it's a good idea to write down any questions you have ahead of your telegenetics visit. You may also want to take notes during the appointment or have a trusted family member or friend to help you take notes. Preparing your space. If you are doing your telegenetics visit from home, make sure you have your computer, tablet, or mobile device positioned so that your face is centered and you can make good eye contact with the camera. You may have to use books or other items to adjust your device to eye level. If you are using a tablet or mobile device, you may want to put it on a stand to keep it steady. Check that your internet or cellular connection is working before the visit. Make sure your device is not on mute and that the volume on your device speakers is to a level that you can hear easily. It's best to be in a quiet, private place for your telegenetics visit. Try to make sure any children, pets, cell phones, or other disruptions are not going to interfere with your telegenetics session. Also, please don't eat or drink during the session. For safety and privacy, please do not do a telegenetics session while you are driving, shopping, or doing anything else where you're not able to concentrate on your conversation with the genetics provider. During the session, after you connect to your genetics provider, have a conversation as you would during an in-person session. Please let them know if you have any difficulty hearing or seeing them at any time in the session. If there are any technical problems, they may be able to continue the session by phone. At the end of the session, the genetics provider will let you know what the next steps are, including any recommendations and follow-up visits planned. They will usually provide further information for you by email or mail. If any testing is recommended, they will arrange for testing at your doctor's office, a nearby laboratory or clinic, or even sometimes at your home by sending you a test kit. They should also give you contact information in case you have any follow-up questions or concerns after the session. Telegenetics is a convenient and safe option to receive genetic services that can benefit many individuals and families. For more information about genetic services, please go to westernstatesgenetics.org, or you can email telegenetics@westernstatesgenetics.org.